for too long, and then when I stand, my left hip pains.
What all is restricting you, like opening your legs, sitting cross-legged, sitting on the ground? Has it become painful for you?
Correct.
It's painful. Do you limp while walking? If you're not having painkillers, will you limp?
Yes.
You will limp. So we'll be using a direct anterior approach, which has no muscle incisions, no muscles are cut, and it's a more cosmetic incision. And we'll probably also be using shorter stem implants, which are the latest, and ceramic implants.
I got admitted just one day before the surgery, and on the second day I was discharged.
Yes.
And I went home for a month or 1.5 months. I took some painkillers,
Yes.
took some support, and then I was able to walk fine. I don't have any pains, I don't have any challenges doing anything.
And the range of motion, which was restricted before, it came back.
Yes.
It has come back. And you you used to go to the gym, and you're able to go right now also.
Yes.
So there's no issues with that.
ये जो आप इमेजेस देख रहे हो जो एक सर्कल में आ रही हैं, दीज आर लाइव एक्सरेज और ये ओटी के अंदर लिए गए हैं बिफोर द क्लोजर। मतलब कि ऑपरेशन बंद करने के पहले हम सिर्फ बिकनी MIS टेक्निक में ये देख लेते हैं कि हमारी इम्प्लांट पोजीशनिंग कैसी है।
Hi friends, my name is Dr. DP Sharma and I am MIS hip joint consultant. Today we are with Rahul. Rahul, what problem are you facing? Can you tell us in short?
Like when I sit for too long, and then when I stand, my left hip pains.
Left hip pains. And you've been facing this since how long now?
Approximately 60 days.
60 days. So it's been 2 months.
Yeah.
And this problem, you understand it to be rising slowly?
Yes.
It's rising.
Yes.
And what all is restricting you, like opening your legs, sitting cross-legged, sitting on the ground? Has it become painful for you?
Correct.
It's painful. Correct. And do you limp while walking? If you're not having painkillers, will you limp?
Yes.
You will limp.
I will.
Okay. And did you start this noticing this thing since when? This limping?
January.
January.
Yeah.
Okay. So how did you come to know about us? And because you've consulted so many of the surgeons, what made you come to us?
Actually, I saw your YouTube videos,
Okay.
and I saw your reviews,
Okay.
and and then I studied about the technique which you do.
Yes.
I studied about it a lot,
Yes.
and then I made my decision because it has a small incision, so
Yes.
the recovery time is lesser.
Lesser. Yes.
Yeah, and
So
that's
like
all,
he's
yeah.
saying, so we use a different technique than all the surgeons do because it's not being trained in a standard fashion. So we'll be using a direct anterior approach, which has no muscle incisions, no muscles are cut, and it's a more cosmetic incision. And we'll probably also be using shorter stem implants, which are the latest, and ceramic implants. So that's what we've discussed. You just lie down, so we'll check the movements also. So we're not having any pain on the right side. So we'll check this one first. So bend this. So this hip is free. So this rotations, all the rotations are free. This is the movement which gets lost the first. Isko modo. So this hip, now your pelvis is moving. It's not letting you move. So internal rotation is completely lost. So now we can see your body is moving completely. Your hip is not moving. Your spine is moving.
Right.
So unlike this hip, this is free. Your pelvis is not moving. We move this and we do this. Whole of your body move because this is arthritic. So the pain stays over here. All right. Right now, when you had painkiller?
In the morning.
In the morning you've had. Now, how is the pain right now?
Right now, like as before. Okay, if I'm lying down,
Like if you'll walk right now, will you limp?
no.
You'll not limp. So especially in the morning when you wake up,
Yes.
there's pain in the first steps.
Correct.
Well, there's pain. So, Rahul, we did your surgery about 7 months back, right? You were having pain in the hips, and we did uncemented THR with DA, direct anterior approach. So, how was your experience throughout? Like, when did you get admitted in the hospital? How difficult was it for you to undergo this painful procedure, and how painful actually was it? And now, how is your life? Like the difference since you were suffering from 2008. So like we saw कि आज आप पहली बार पालती मार रहे हैं. So how good or bad is your experience after the surgery?
Oh, well, now it's like kind of normal, you know, like before it used to be a little stiff and a little pain at times. Then it got worse, you know, when I thought of, you know, getting into a surgery.
Right.
I got admitted just one day before the surgery, and you know, on the second day I was discharged.
Yes.
Then I went home for a month or 1.5 months. I took some painkillers,
Yes.
took some support, and then I was able to walk fine.
So now how does that hip feel to you? Does it feel any different, or you just forget about it?
I don't have any pains. I don't have any challenges doing anything.
And the range of motion which was restricted before, it came back.
Yes.
It has come back. And you like you used to go to the gym, and you're able to go right now also.
Yes.
So there's no issues with that.
No.
All right. Okay. So anything with that you were thinking that this I won't be able to do? Is there any restriction that you were not able to do right now also? Like something you thought of that I won't be able to do like this, like because there are a lot of restrictions when we do it from the posterior approach. We don't let you sit in cross-leg position or on the ground or use the gym. There's a lot of chances of dislocation. We use pillows in between the legs, all these kind of things. So are you facing any issues with them? No. All right. Thank you. So friends, let's discuss what we had done in Rahul's case. So here you're saying the X-ray. आप देख रहे हो कि इनका जो लेफ़्ट साइड का हिप है वो बहुत ही ज़्यादा डैमेज्ड है. उसका साइज़ इनलार्ज दिख रहा है आपको बिकॉज उसमें ऑस्टियोफाइट्स बन गए हैं. ये ऑस्टियोफाइट्स क्या होते हैं दोस्तों? यही एक्स्ट्रा हड्डियाँ होती हैं जो हमें हमारी बॉल को रब करती हैं और वहाँ का मूवमेंट ख़राब कर देती हैं. सपोजिटली अगर आप ये देख पा रहे हो तो ये एक स्मूथ हेड है. इसके आसपास कोई भी रेस्ट्रिक्शन नहीं है, कोई भी प्रॉब्लम नहीं है, किसी भी डायरेक्शन में मूव कर सकता है, एकदम स्मूथ है. अब अगर हम देखें कि आर्थराइटिक हेड कैसा हो जाता है, तो आप देख रहे हो कि ये नुकीली चीज़ें यानी स्पाइक्स, बोन स्पाइक्स आ जाते हैं, दे कम आउट, और ये इसको मूवमेंट को रेस्ट्रिक्ट करते हैं और दर्द करते हैं. तो दैट इज़ द मूवमेंट के दैट इज़ द रीज़न के मूवमेंट रेस्ट्रिक्ट हो जाता है. नाउ लेट्स सी द मोस्ट इंपॉर्टेंट थिंग ऑफ बिकिनी MIS. बहुत इंपॉर्टेंट चीज़ जिसके बारे में हम बात करते हैं. ये जो आप इमेजेस देख रहे हो जो एक सर्कल में आ रही हैं, दीज आर लाइव एक्सरेज, और ये OT के अंदर लिए गए हैं बिफोर द क्लोजर. मतलब कि ऑपरेशन बंद करने के पहले हम सिर्फ बिकिनी MIS टेक्निक में ये देख लेते हैं कि हमारी इम्प्लांट पोजीशनिंग कैसी है. कई लोग हमसे आर्ग्यू करते हैं कि हम जो ऑपरेशन करते हैं ओल्ड टेक्निक से, उनसे हम इम्प्लांट पोजीशन बहुत अच्छी लगा पाते हैं. आप कुछ भी कर लें, कितने भी क्लिनिकल पैरामीटर यूज़ कर लें, एक्सरे से ज़्यादा अच्छी आप पोजीशन डिटरमाइन ही नहीं कर सकते. और कितनी ही बार हमने देखा है ओल्ड टेक्निक से जब ऑपरेशन किया जाता है साइड में लेटा के एक के ऊपर एक हिप में, उसमें आपके हिप के एक्सरेज ठीक नहीं ले सकते, ऑपरेशन में मशीन लाने में प्रॉब्लम होती है, और उनका जब एक्सरे होता है अगले दिन तो वो ऊपर नीचे पोजीशन में हो जाता है इम्प्लांट, जो डिटरमाइन करता है कि हमारा हिप कितना चलेगा या कितना कम उसमें डिसलोकेशन का चांसेस होगा. तो दिस इज़ द बिगेस्ट एडवांटेज दैट वी आर एबल टू चेक आर पोजीशन ऑफ इम्प्लांट एंड वी आर एबल टू रिवाइज इट. अगर हमें लग रहा है कि इसको थोड़ा सा और चेंज करना है पेशेंट के हिसाब से, तो वी कैन चेंज इट एंड वी कैन कंफर्म इट इन द एक्सरे, सो वी डोंट हैव एनी सरप्राइजेस और मिसहैप्स इन द पोस्ट ऑपरेशन एक्सरे एंड पीरियड. आप ये देख रहे हो कि इनका जो एक्सरे था हमने ऑपरेशन के बाद किया, ऑब्वियसली ये परफेक्ट ही आना था. एकदम अच्छा कप इंक्लिनेशन है, बिल्कुल अच्छा से स्टेम इंटीग्रेशन है, एंड द पेशेंट इज़ नाउ गोइंग टू जिम, लिविंग हिज लाइफ पेन फ्री एंड लिम्प फ्री. So friends, if you have any doubts about hip replacement, we have the best techniques available and we do it from all kinds of technique.
जैसे भी पेशेंट रिक्वेस्ट करता है, वी नो एंड वी हैव द फैसिलिटीज़ टू डू इट इन ऑल टेक्निक्स एंड डोंट हेजिटेट टू कॉन्टैक्ट अस। आप हम व्हाट्सएप कर सकते हो एंड ऑनलाइन अपॉइंटमेंट भी बुक कर सकते हो। थैंक यू सो मच एंड हैव अ नाइस डे।